So my name is Tim Andrews, and today I'll be talking about my advocacy project. So I kind of did a very different methods, a wide variety of methods for how I kind of came up with the ideas that I came up with. Some of the ideas I kind of just did a brief brainstorm ahead of time, and then a lot of the ones was a brainstorming call that I had with the high school athletic trainer Doug Horton. One of the reasons why I wanted to talk with Doug and come up with ideas together was because what I've learned from the last couple of months working at the site that I'm working at is that we need to kind of be on the same page. The high school and the middle school, we kind of need to have the same policies because there's some people that work at both places, and it's also for the students when they go to the high school, they're kind of used to understanding how things work. So that's one of the reasons why I came up with some ideas on my own, and I talked with Doug, but I kind of wanted to go together. I guess I should have recorded our conversation because we kind of did a wide variety of different methods of how we came up with different ideas, trying to challenge each other on different ideas, or just try and focus on just the solution, or reverse. That's kind of the different things that we did. So anyways, and so some of the things I also, after we had this discussion, I kind of picked some different things out and looked at different solutions and things like that. So anyways, so the first thing that we kind of talked about, problem that Doug has, is that everyone has access to the athletic training clinic. Many of the coaches have keys; they have access there, and the problem is that everyone they give the keys to the athletes. There's no and then there's no supervised students in a healthcare facility. They could be goofing off or whatever. It's not good to have full access. Doug has put on locks on all the cabinets, but still, and he's posted signs, and him and the athletic director have sent out emails and things, and they have not had anything happen. And one of the arguments that the AD came up with was, that it needs to have access to emergency equipment in case Doug isn't there. But one thing that we could focus on instead is training coaches on emergency response. And also Doug mentioned that they're already given a med kit that they're supposed to have with them all the time, and it has all the emergency equipment. So that's one thing. Improved communication. The next thing was improved communication with coaches on injuries, especially during away games. If they know that an athlete is going to see, or if they know that an athlete is going to see a different healthcare provider, like a doctor or something, sometimes Doug doesn't hear about it for a few days. Problem is that coaches have had difficulty communicating with AT staff. This has gone on and sometimes it goes on for a few days or without him knowing. So, one argument against this is that maybe the coaches are really busy. The coach thought that the student had already told the AT staff. So some possible solutions to some of these problems is maybe in the injury form that the coaches have to complete with all things that happen. Or also, maybe we could have some sort of reward, or if they call or tell within a certain time to the athletic training staff, like what's going on or what has happened. We talked about rectal thermometry, but I don't really want to focus on this because I think we already kind of solved this issue. The other thing we talked a lot about was with communication from physicians. Some of the times we have very limited information on them, just a return to play date, and so sometimes we feel like we're limited in how we can provide patient care. Sometimes, and we've called physicians with limited response. And Doug said that from some providers he used to receive dictated notes, but that in the mail, but now that has stopped. So some possible solutions for this is a form that students need to fill out, and giving the form and then also we could give the form to the providers in the area, and that way they know if they're seeing a CVIL athlete, that they need to fill out this form. From the provider point of view, maybe they would be unwilling to fill out another form that's not their own, or they just don't feel like they have time. Between patients, they forget, the patient loses the form. So that is one problem with that. Maybe a good first step would be to have Doug and I go and talk with the providers in the area, maybe sending an email to meet with their staff, and then we can leave our business cards and instructions on communication. That might be a good first step. And then if that doesn't really work, then we can try some of the other things. Another solution is, going to patient appointments, meeting with them. That sometimes can be difficult, and honestly, I've tried this a few times, and the patients don't really want me to come with them. So yeah, that's one of the issues. And this time I kind of think of the problem first. So problem is that the coaching staff that are, not all the coaches are CPR certified. And so it used to be that, we had to have at least one teacher on staff, and now that's not the policy. So there's a lot more outside coaches that have various range of knowledge on how to handle emergency situations. So some possible solutions are making a requirement for, maybe every coach or 75% of coaching staff to be CPR certified. Other things that we can do is providing CPR classes at various points throughout the year. And I also think that those should be surrounded with simulations. So whether the simulations are happening before a CPR class is offered or after a CPR class is offered. And so then that can kind of help this coaching staff realize that they need to be more prepared and have more knowledge on how to handle emergency situations. So that's kind of what I got so far. There's some certain ones I'm leaning towards, but yeah, that's what we got so far. Thanks for listening.